Hey guys, Jeremy here. Well, it's the day before my eye surgery, and I kind of wanted to take a few minutes and show you guys what my eye does. Those of you who haven't been around me a whole lot may not have caught this. I've taught a lot of classes, taught a lot of different things over many years, and I've always been able to control this fairly well. But I thought, for those of you interested, here's the backstory on my floating eye. So, as far as I know in my history, basically I did not have a floating eye as a child. It was around 8 years old, maybe 10, that was the first time that I really remember my parents going, hey, something's off. And we were playing baseball, and I was trying to catch the baseball, and I kept missing. Basically, when the object was coming at me, I would see two of them. And so I would reach for it and try to catch it, couldn't catch it, kept trying to catch it, and basically I think they thought I was just playing dumb and couldn't catch it, so they ended up throwing it at my head, and I still reached for the supposed other one, and I guess when they figured out that I wasn't playing a game was when they hit me in the head with a baseball. So then I went to the eye doctor. Long story short, eye doctor recommended glasses, so we tried the glasses thing, and all I remember as a kid is when I wore the glasses, I got a severe headache. So I would put the glasses on, and while the glasses were on, I would push my eye out to avoid the headache. So the glasses were basically a prism to help direct the eye and pull it into alignment. And I would fight it, and I would push my eye out. And when I would do that, I guess I was developing a muscle and the control of that eye. And we did a lot of eye exercises, did what I kind of refer to as a trombone. We'd put stickers on things, and I'd have to, track it left, right, up, down, all that. And I did those eye exercises for quite a few years. Long story short, here's what I can do with my eye. So for those of you who haven't ever seen, my natural, I am right eye dominant. Yes, I am 100% sure. Through lots of different ways, but I know that I am right eye dominant, always have been. My right eye is lazy, so it goes to sleep, floats all the way over here. But the crazy part is I have full control over it, so I can sit here and I can have a conversation, I can conduct business, I can meet with customers, teach classes, but my eye naturally wants to go to sleep. The really interesting part is that I can also make my left eye do it, this eye, and then I can switch back and forth. So I have the ability to be able to move my eyes constantly, and then I can bring them back together. So my natural, if I get really tired, if I'm struggling to see, my right eye goes to sleep, just like this. And then I can pull it back in, and literally in the blink of an eye, I can correct it. So if I'm looking, basically I'm sitting in front of my computer right now, and I can't read any of the letters on the screen. I can't read, I've got Google up on my computer, and you know how big the letters of Google are, and I know what it says because I know what the letters are. And if I close an eye, I can see clear with this eye, and if I close this eye, I can see clear with this eye. But if my eyes are together, everything's fuzzy. And when I say fuzzy, through the eye doctors, the appointments, everybody that's talked to us, when I say fuzzy, I actually see multiples of objects. So if I'm looking at one object, I'm actually seeing between 3 and 4 objects, kind of depending on how you want to phrase it. Now, I know that sounds crazy, but basically think about it as my eyes are being focused and pulled together, and I'm trying to focus on them, but my two eyes, as it's been described to me, are pointing in slightly different directions. So as those two eyeballs are pointed slightly different directions, my brain is trying to fill in the gap. And I've got a little bit of vertical displacement on my eye, but I also have horizontal displacement, so they're not pointed the right direction. And that is creating what most people refer to as double vision. So double vision is what I've always thought I kind of experienced. And going back on my history, people who know what I've done, a lot of years of martial arts, a lot of years fighting. I was in the military, done competitive shooting and firearms instruction for many, many years. And long story short, it was around 25 years old that I began to kind of catch myself while I was running my construction company. I would catch myself closing an eye so I could work. And friends of mine that were really close, I'd always told them, hey, if you ever see my eye out, you know, give me that snap and say, hey, dude, you're staring at this guy over here. Look back at me. And, you know, so if my eye had gone out and somebody goes, hey, and I could snap it back in and I can go back to talking. But because of that, I continued to develop the ability to control it and never had a problem with it. But when my eyes were in, I couldn't see as well as I used to be able to. I've tried glasses. I've gone back and done the eye exercises, done all that. And I just turned 40, and I am at the point where I cannot function with my eyes in. I can't read what's in front of me. I can't read what I'm writing. If I want to read something, I mean, this is a good example. So there's a notepad, right? And I don't even know what it says. So there, I'm looking at it. Basically, when I do this, if I try to read it, and wow. So I'm this far from my face and I can read it. But even here, the letters are trying to pull apart. If I go this far, basically, I mean, I'm not at arm's length. At arm's length, I can't read anything. I can't even see the truck and industrial parts. I can't even read it. I can't see the T. Sure can't see the B. If I get about here, I can make out the biggest letters, but there's no way I can see the small ones. So that's where I'm at. So the only way I can function is I either let my eye out or I close my eyes. Now, there's a lot of things that come into play. When you're conducting business with people, I look at prints all day. Blueprints, architecture prints, and every day I'm trying to read those. Well, I can't read them unless I let my eye out. So those of you who've been around me know this. I wear sunglasses all the time. I wear them all the time because when I function with people, the only way that I can read what I need to read and still look at them and look normal is if I cover my eyes up. The other thing is, people who've been around me for a long time know that I'm pretty quick at knowing when people are looking at me. So I'll stare at them, I'll have a conversation with them, but I can't see facial expressions. I can't see details. You know, I can walk through, like at our church, I'm going to walk through the main foyer and I don't have a clue who I'm looking at. So people are like, man, you're really standoffish and you just sit back and you watch people. Well, the reason I sit back and watch people is because I can't see them. So it's really, really created a self-conscious aspect that I don't know how many people know. And then, of course, you know, I'm the whack job with the guy who his eyeball's sticking out the side of his head. So when I catch myself doing that, I'm doing that and I'm trying to look at people. So I'm not walking around with squinting, having an eye closed, which looks just as retarded. So that's how I function. That's how I've gone through life. So the surgery that I'm doing is this. It's called and I've got it pulled up actually on my computer, so don't mind me, I'm having to read. I'm having a left lateral rectus recession. Don't know where the rectus comes from, but it's not on that. It's my eye. But the rectus recession, and then I'm having a medial rectus resection, which is basically a massive shortening of this muscle, which will theoretically, I believe, from the best way I understand it, is going to redirect this eye closer to center so that when I fight it and I pull my eyes together, that my brain and the muscles don't have to work so hard in order to pull that eye in. And then on this one, the doctor's saying that I have a slight, where'd it go? It's having a slight misalignment of my left eye as well. So they're doing the, the lateral rectus recession in my left eye and a medial rectus resection in my right eye. And that's going to be the surgery. And I made the mistake of about 2 days ago looking it up on YouTube. And that just about freaked me out. So I about canceled the surgery. They literally are going to pinch my eyeball, pull it to one side of my head, cut the side of the eyeball, reach in, sever the muscle, reposition the muscle, and surgically restitch it back together. And I don't know about you, but I only have 2 eyeballs, and that freaks the living bejeebers out of me that somebody's going to be cutting on my eye. But at this point in my life, I don't know what else to do. So it's the day before surgery, scheduled for around 8:30 tomorrow morning. I check in on to the doctor at 7 a.m. Tomorrow night, I'm going to ask my family to kind of do a video recording, and I'm going to do some update. Here's basically why I'm documenting this. My doctor wouldn't explain in detail what I'm experiencing, what I'm about to go through. To be completely honest, I don't think they fully understand what my vision looks like. So I'm trying to document what I see, how things look to me, how well I can control them and what I can do, and the tracking of my eyes. So one other thing I wanted to do was, if I look directly at the camera and I just look as far to the right, up and around, as far to the left, down. I don't know. I've heard that some people struggle with tracking. So I wanted to do that just to be able to have a visual comparison. Obviously, that is the distance that my right eye goes to sleep. So if I turn my head, it looks relatively close to normal. As I come back, that left eye goes to sleep, and there it shifted. So, and I'm not doing that on purpose. When I turn, that's what happens. Another thing that happens is, if I cover my eye, not close my eye, if I close an eye and I open my eye, man, I don't know, actually. If I close my eye and I open it slow, it's asleep, check that out. If I close this eye and I open it slow, it's asleep. So no matter which, if I close the eye, my brain is shutting this eye off, because when I open it, it's asleep. That's interesting. I actually never knew that. Yep, absolutely asleep. Another thing is, if I cover it, and so if I cover that eye and I'm looking with my right eye, it puts it to sleep. If I cover this one, well, sorry, of course it was out. If I cover this one, it's asleep. So I can cover this one. And that's what happens. And that's the kind of stuff that I deal with every single day. So just for those of you who are interested, that's kind of what I'm dealing with. There's the putting it out there. And if you're interested or want to know what the heck my eye does, there you go. It is January 23rd, 2020. So one of my friends made a pretty good crack. He said, hey, don't worry about it. Tomorrow you're going to have a new outlook on life, and you should be good to go. And then another friend of mine thought it was really witty of him to say that in 2020, hopefully I go back to 2020 vision, and we'll see how that works out. So maybe that's a good omen, and I'll have a good result off of this. But I just wanted people to be able to know. One thing I am going to do is I'm going to post this under, hold on, one other word I have to read. The surgery, strabismus. So strabismus surgery is actually, from what I understand, the technical term for what this floating eye is. My eye doctor has said that I have a intermittent, I believe he used the term intermittent floater, which I completely disagree with, because my right eye is the only eye that ever floats on me. The only way my left eye goes out is if I make it do it. Basically, I've learned that as my eye goes out, every image splits. So if there's one image, when my eye floats, there's 2 images. There's a main one, and then there's kind of a see-through one. And if I'm 20 feet away, then that image moves about 10 feet. If I'm 100 feet away, it moves approximately 50 feet. If I'm 5 foot, it moves about 2.5. And why that's relevant is, I believe that has to do, and by the way, just so that you can see it, if I'm looking at you and my eye goes to sleep, the second image of my camera actually shifts over here to my left. It does not shift here, which you would think. It shifts over here. So I'm looking and the camera's clean. It's right there in front of me. If I let it out, the camera shifted and there's a kind of invisible one over here. So every time that I see things, that's what happens. And that's why trying to read is so ridiculous, because even when I let my eye out, there's two images. When I'm looking at it, those images they're stacked. It's like trying to look at multiple things like this. If everything was stacked right on top of each other, it'd be clear, but I'm looking at it and it's kind of like that. So it makes it impossible for me to be able to focus on things. They say that because of it, I don't have good depth perception, which I know, but I've compensated my whole life. They also say three-dimensionally that my ability to see 3D is very much limited. Now, I don't know how true that is, because it's not always asleep. It's not always together. I use one eye, and monocularly, you cannot see three-dimensionally with only one eye. And that pretty well is the only way I've ever seen. So hope that makes sense. If you guys have questions, let me know, because I honestly, I'm documenting this so that anybody else out there who has this maybe can listen to this and have a real conversation about what I see and the surgery. And then I'm going to go through a very in-depth what I see after the surgery, because that's the biggest thing that no doctor has been able to communicate to me on how this is truly going to affect my vision. I'm not interested in just correcting this, because I'm in control of this. The problem is when my eyes are together, I cannot see clear. I can only see clear if I use one eye or the other. And I can see just fine equally out of my right eye and my left eye, but I cannot see well when I use them together. So that's it, guys. Check it out. It is 4 o'clock on Thursday, January 23rd. Time to go to sleep and get up, go to the surgery, and we will see where we go from there. I'll talk to you guys in a day or so. Take it easy.